They've created a Kindle for the diabetic. They've created a platform which is as much about monitoring and measuring and delivering the insulin as it is about accumulating other purchases from the device they're going to be carrying with them at all times. This concept, which we call personal supply chain management, is moving into other devices where the order button is being put on the razor blade handle. If you think about that, what would happen if your razor blade handle had the order button? So at the moment you realize you need more razor blades, you just push the order button. You're going to see that principle. It's already come into the market around things like drug medication containers, pill bottles. You're going to see it in the diabetes arena. And you're going to see it eventually, I think, on some consumer products where your dishwasher or your washing machine may sample the water quality, determine what soap is appropriate, and you can order more soap right from the machine in the Internet of Everything. Apply the same principle. We're bringing that principle into the consumer space of health very, very fast because there's a very large return on investment when the developer of a product can tie a service to that and fulfill that razor blade point of sale. We think we're going to move from a point of siloed information to mashups of information. And informatics is where you're going to learn to think about your health, perhaps in the form of a score, perhaps in the form of pushed information to you where you're kind of advised what to do next, perhaps in information going to your caregiver, family, or healthcare professional being told what to do next. But this area of taking information from multiple devices, multiple sensors, mashing it up together, perhaps combining it with their electronic medical record information, etc., is one you're going to hear a lot about over the course of the next 5 years or so.
So the challenge with something like a diabetes monitor, something like a heart monitor, anything where there's any risk to the patient of the device going wrong, is that we have an agency in the United States called the U.S. Food and Drug Administration. And the U.S. Food and Drug Administration, as you know, is charged with ensuring the safety and effectiveness of every medical device in the United States. And as a company that's focused on building the next generation of technology for diabetes, we've spent the last 2 years taking this from something that had wires hanging out of it when you first saw it into what's now the first FDA-cleared glucose monitor that contains wireless technology and automatically sends every single glucose reading that a patient takes up to the cloud. And from there, it goes to the doctor's electronic medical record, to the cell phone of the mother of a patient with a child with diabetes, to the cell phone of the adult child of an elderly person with diabetes. In other words, it takes a glucose monitor from something that 28 million Americans use today in a completely disconnected manner, where they look at the number, write it down on a cocktail napkin, talk to their doctor every 6 months about what they did wrong, takes it from that paradigm to a paradigm of connected health where on a daily basis the patient is getting coaching and feedback right on the device, where, as you said, if the patient is running low on supplies, we actually say, you're running low on supplies, would you like more, yes or no? Completely disintermediating the supply chain and really taking it from a device that people have used poorly for the last 20 years to a device that has the potential to reduce complications of diabetes massively. And if you want to know why that matters so much, right now 10% of people in the United States have diabetes. 15% of what we spend on healthcare, we spend on the costs and complications of diabetes. And all we need to do to massively impact that is to improve the extent to which people monitor their glucose and control it.
Here's an iPhone 4S. I'm not going to use Siri, but I will show you. And on that 4S is an iPhone case, except the difference is this iPhone case has integrated into it an electrocardiogram. And so simply by touching the electrodes on the back of this case, I'm able to record and transmit and analyze my electrocardiogram. Now, while this is an iPhone case and an iPhone 4S, today, for the first time in public, I'll demonstrate an Android with a very slim credit card-like device. And again, exactly the same fashion. I will start up our application and show you your ECG being analyzed, recorded, and literally going to the web. Oh boy, I'm nervous, aren't I? In real time.
ResMed is about $1.2 billion company, a global leader in sleep and respiratory medicine. And our job is to make the chronic disease cost come down, treat people for sleep apnea. And we have, again, reducing the cost of diagnostics. That's one of our primary way. Instead of going to the sleep lab, we also have a device that is FDA cleared, which treats, it's a home sleep test device that you can take it home. It's got about 4 channels, tests the pulse, the oximetry, and then also has a belt, effort belt that goes around. It can test the effort, and then there's a nasal cannula to test the flow. With a simple device like this, you can have sleep tests done at home. You talked about bringing hospital to home. This is one area where we are working to bring sleep tests away from the sleep lab into homes.
And I would assume a user using this kind of diagnostic device at home is more likely to sleep better in their own bed.
Exactly.
And have a better experience capturing the relevant data.
Exactly. That really helps them to go through the diagnostics with sleep, more hours of sleep than not sleeping.